In the last couple of years, and then most recently, we have Medicare endorsing, at least paying for screening CT scans. So it remains to be seen the uptake of routine screening. Certainly, cancer screening is embedded in the primary care community. We screen for breast cancer, we screen for colon cancer. It's controversial whether or not the prostate cancer should be screened for, pap smears for cervical cancer, and those sorts of things. So lung cancer is just an addition. We had a very nice study, the lung cancer screening study, the National Lung Cancer Screening Study, that showed a 20% reduction in deaths from lung cancer. It was done in patients over the age of 55 up to about 70. And patients who had smoked at least 30 pack years. So it's in a select population. We really don't know how to screen patients that wouldn't have fit into that category. But I think in those patients that were, would have been eligible for that screening trial, that their primary care physician should discuss lung cancer screening. One of the difficulties of being a lung cancer doctor, which I've been for 25 years now, is that historically we have relied on patients presenting with symptoms. And 70% of our patients present with stage 3 or 4 disease, so it's very advanced at the time of diagnosis. If you look at breast cancer, 90% of the patients present with stage 1 and 2 disease. So I'm hopeful in my professional lifetime that we will start to see a shift in the stage distribution at the time of diagnosis as a result of screening. That remains to be seen, but at least we can hope that patients will be diagnosed earlier, and we know cure rates are higher the earlier you diagnose the disease.